When we talk about societal challenges, be it healthcare or otherwise, those were areas that traditionally were being perceived the exclusive domain of the public sector and of donors and of NGOs. I greatly encourage private sector to redefine their strategies and policies and align them with the SDGs. That will not only help the world to become healthier and more sustainable, it also constitutes a very good business opportunity. We strongly believe that if we want to make healthcare accessible to all by 2030, which is the SDG 3, as you know, that you need to start with communities and strengthen primary healthcare in communities. This is really where also the public sector and the private sector need to join forces. As Philips, we are doing that, for instance, in Kenya, where we have started in Kiambu County a community life center, which is a community-based primary healthcare facility. And we do that together with AMREF, we do it together with the Minister of Health, and we provide healthcare to people that previously were deprived from healthcare. The number of outpatients have been quadrupling since we started 18 months ago, and we like to believe that we have been contributing to saving lives. Well, the interesting thing is that when you take a community-based approach, you also empower communities and make them more resilient. This is not only putting infrastructure in place and leveraging technology. This is indeed training people, engaging people, making them also responsible and accountable for their own health. We do that, and we see that the effects of that on that community go beyond healthcare, which is very nice to see. For instance, in Kiambu County, but also in Madera Country, where we do this, we see that those community life centers also become areas where economic activity is being developed, but also where people exercise after hours, because we have solar powered lighting. So when the sun sets, children can still play. And we also see that children make their homework after hours in those communities, and those communities attract teachers that help them with their homework. So you really see that the activity go beyond what was the original intent. It's providing access to primary healthcare. We need to make use of digital technology. That will enable us to leapfrog and make sure that underprivileged communities get access to care. Secondarily, partnerships are of crucial importance between the public sector and the private sector, but also within the private sector. And last but not least, we need to make sure that we have the right business models and financing vehicles to enable all of the above.